So I'm open to Module 11, which is the last module covered in week 5. And to piggyback on the last module, we are also covering pain. This is chapter 12, which is all about managing pain, so pain treatment. If we skip down to the objectives, I'm just going to really quickly breeze over these, but really we're just looking at all the various approaches to managing and controlling clinical pain. So again, like I said in the last module, we're going to be focusing a lot on chronic pain management because that is really the meat of the issue, is for chronic pain sufferers, how to control and manage that pain over their life course, which many are dealing with. So we'll be looking at various treatments for pain, including those that are biological, or we refer to them as medical treatments, and how effective those are, how they're delivered in the healthcare setting, and what kind of outcome do they give for pain relief. But we'll also be looking at a variety of other techniques. So looking at behavioral ways of managing pain, like reducing fear, so emotional regulation, relaxation, biofeedback. All of those things can be used to manage pain as well as to treat it. And also tapping into some of those learning theories, right? So we can use operant and classical conditioning oftentimes to our benefit to treat pain. And so we'll be looking at some interesting ways of doing that, and how it really, as you're going to see, requires a collaborative effort amongst patients and their healthcare professionals. So it really requires having that solid relationship, which we've talked about in previous chapters, of just how important the healthcare professional becomes in the life of a person dealing with chronic pain. This is a person who's seeing their doctor or their specialist or their pain management specialist very often. And so that relationship starts to become a very important one. We tend to see those people as becoming the gatekeepers to pain management. So back to the different methods behaviorally we discussed, also looking at some cognitive methods for pain management. A lot can be done with cognitive behavioral therapy for managing pain, and even forms of hypnosis for those who it works on, and interpersonal therapy. These come from the field of psychology and have been used very successfully for many patients. Stimulation therapies, such as acupuncture or acupressure, can be very helpful. Even virtual reality, which kind of touches into the biofeedback area, but virtual reality is being used for different types of pain treatment. And we looked, I think, last chapter at things like phantom limb pain, where it's more of a neurological pain, or it's very psychological in terms of your brain still sort of transmitting messages from a limb that is no longer there. Well, a lot of that has to do with how the person is viewing their pain and the feelings that are evoked when they think about their pain and what it's doing in their lives. And so all of that can be used to the clinician's advantage in trying to help and treat that person in a cognitive way, think or rethink about their pain differently. And this is really the primary role of a lot of pain clinics today. Despite being maybe a top-notch pain clinic, that doesn't always equate to I'm going to get rid of patients' pain. A lot of patients inevitably will have to live with their pain, unfortunately for some, the rest of their lives. So it really becomes a getting away from trying to get rid of the pain and really focusing on how to help people live better with the pain. If getting rid of the pain is not possible, how do we give people a better quality of life despite the pain that they might be experiencing? So we'll take a look at some multidisciplinary approaches to pain management, and how the effectiveness of those approaches is being measured, and where are we seeing effectiveness, where are we seeing success for patients. And again, success is often measured or gauged by the individual, because as we've seen, there are a lot of sociocultural factors that can affect pain. So what works for one person isn't always a guarantee that it's going to work for another person, because of those individual differences or environmental differences that can come into play. So it's a good chapter. I've got your lecture slides here, and then I also have the video. I mentioned it in the last module. This is a video on pain management. You're going to be taking a look at a pain management clinic run by Dr. Jon Kabat-Zinn, who has a medical degree. He's a medical doctor who has really studied the practice of Buddhist meditation and been able to successfully implement a pain management plan for his patients that revolves around meditation. Really, it's a behavioral and a cognitive strategy that he's using to help patients escape their pain a little bit, and with that, have a little bit of pain relief where they can't find that type of relief anywhere else. So he deals with the hardest cases of pain patients, patients who have been through the ringer in terms of trying to find something that works and nothing does. They usually come to him. So he is still fully operational right outside of Boston, his clinics. So the video you're watching is a little older of a video, but it's excellent, and he's still very much working with patients and really going around the country and training other doctors and other clinicians how to best treat pain in their patients, and they're having such great success, and patients are really pleased with the outcomes, mainly because it puts them in the driving seat. It gives patients something to do. It makes them feel like they have a little more control, and we learned about that earlier in the semester, how important control is. And when you're in pain and you're experiencing chronic pain on a daily basis, it can feel very out of control. So any way that the patient can be given back a little bit of independence and success with managing their pain is a win, and is really a good thing. So you'll be watching the video and you'll be filling out the questions and then submitting those via the assignment button here. And then lastly, your discussion for this module is based on the reading in the longevity book, and this one's dealing with social relationships. So key measures of social relationships. So we're really taking a look here at what we like to call social support. Why is it important? Why does it matter in our health? And you've no doubt already read that in several of the Serafino and Smith chapters. And one thing that the book is really good at doing, the main text, is providing very good context for looking at health overall. And it's been echoed in several of the chapters just how important social support is, the support that we receive from others in various ways. So here's where the Terman study and data set really piggybacks on the readings in the main text very well. So I hope to see a lot of integrating of the two sources to showcase what you've been learning and what you know really about social networks when it comes to longevity and when it comes to our health. And I think there's some misconceptions definitely that exist about our social life. Key thing being, we think the more social you are, the better. And there's truths in that, and then there's things you're not kind of seeing in that. So I want you to unpack that a little bit. Was it the people who were super social that were the healthiest and lived the longest? Or was there something about being social? Was it how they were social and who they were social with that mattered? So I'll let you kind of look at that a little bit deeper. and definitely be integrating in all of your sources for this discussion. I think you'll have a lot to pull from. And that does it for week 5 and module 11. And please let me know again if you guys have any questions.